Sarojit, whether you are able to reach out to Shika Malhotra?
Yes, sir. She says she's joining, sir.
Already 3,000 have joined.
Yes, present, sir. Now we start. I welcome all the participants. I'm so glad to have the 3,000 participants on board today with us on 7th April. I'm really very, very glad to see that. I welcome all the speakers over here. And I would like to give a brief description of today's program. I think you all have seen the program today. And let me tell you about today, why we are all here. Today being the World Health Day. You must be knowing the April 7th of each year marks the celebration of World Health Day from its inception at the first Health Assembly in 1948. This year theme is building a fairer, healthier world for everyone. The campaign highlights WHO's constitutional principle that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic or social condition. The places where we live, work, and play make it harder for some to reach their full health potential while others thrive. However, health inequities are preventable with strategies that place greater attention to improving health equity, especially for the most vulnerable and marginalized groups. COVID-19 has hit all countries hard, but its impact has been harshest on those communities which were already vulnerable, who are more exposed to disease, less likely to have access to quality health care services, and more likely to experience adverse consequences as a result of measures implemented to contain the pandemic. Now, I welcome all the speakers of today's on the World Health Day on our INC platform. Dr. Girdhar R. Babu sir, can you raise your hands? Because I will, introduce you to our participants, because we are really pleased to introduce you. Dr. Girdhar R. Babu, he's a professor and head Life Course Epidemiology at Public Health Foundation of India. He has a medical degree from Kasturba Medical College, Manipal, and has completed MPH, Master of Public Health, and PhD from UCLA, that is University of California, Los Angeles. He has 2 decades of experience in public health research, practice, and academics. He began his career at the Center for Community Medicine of All India Institute of Medical Sciences, New Delhi. He worked with World Health Organization, where he led the efforts in stopping polio transmission in the state of Karnataka. He initiated advocacy for measles surveillance in Karnataka, leading to constitution of multi-year plan for measles elimination in India. He is awarded with the prestigious intermediate and now the senior fellowship of Wellcome Trust DBT India Alliance to start and expand cohort study. The cohort is named as MASTI, that is maternal antecedents of adiposity, studying the transgenerational role of hyperglycemia and insulin. Dr. Girdhar has over 100 papers published in national and international high-impact journals. He has served on several national and international committees. Some of them include Lancet Commission Task Force on COVID-19, ICMR, National Task Force for COVID-19, and the Technical Analysis Committee of the Government of Karnataka. He is the regional representative for LMIC on the Doha International Society. He's actually involved in writing articles for general public, providing his expert opinion to media houses and consultation to several states. His work on COVID-19 can be accessed. I will give you the in detail on the chat box, that is https://giridhar.org COVID-19. I will share with you later on. And you must all be scratching your head. Where did I see him? Yes, you must have seen him all in the leading national news channel. I mean, NDTV, India Today. I just watched him yesterday. So we have a pleasure inviting you, sir. And I'm honored to introduce you to the participants. Now, let's have a President INC, sir. So will you please raise the hand? Yes, sir. So now let me introduce the president. I mean, everybody knows in our country the President Indian Nursing Council. Who doesn't know about him? But I would like to give a brief about him today. He is the Dr. T. Dilkumar. He's the President Indian Nursing Council, and he's ex-nursing advisor for Government of India. He's having long-standing 43 years of experience in nursing. He is also a member of Global Advisory Group on Nursing and Midwifery of WHO. He was the first nursing professional from India to become the member of the Global Advisory Committee of WHO. The said committee used to advise WHO on policy issues on nursing and midwifery at global level. As a nursing advisor, he has initiated various schemes under development of nursing services, to name few like upgrading the schools of nursing into College of Nursing, strengthening schools and College of Nursing, continuing education of nurses, and revival of national awards to nursing personnel given by President of India. As the President of Indian Nursing Council, he has initiated many reforms in nursing education field and instrumental in establishment of National Reference Stimulation Center, INC, to be a member of International Council of Nurses, which created voice for Indian nurses at global level. And he's also responsible to sign MOU of BRICS with the BRICS National Nurses Alliance. He has launched the process of live register. I mean, you all know about NRTS. So, sir is the vision behind this for nurses led by the INC, and enumeration of nurses data, which will be landmark decision for the development of nursing in India. I have a pleasure and honor to invite you here today on this platform, sir. And here we have our very pleasant and charming Vice President, Dr. Aisha Amma. Everybody knows her, right? She is ex-principal of RAK College of Nursing, and she's a Vice President of Indian Nursing Council. Ma'am, we thank you for supporting in all the INC endeavors and also supporting us. I mean, Madam is very, it's very pleasant working with her, and she's very, very supportive to us. We get about down with some, but she is there to say, no issues, Bharti, go on. That's what Madam has it. So we are very pleasure to have you here in this platform, ma'am. Thank you, ma'am. And another charming lady in our council, Dr. Sarvajit Kaur. And here I just want to invite you to this platform, ma'am. And for me, it's a pleasure working with her. She's very supportive and also charming. She makes us cool all the time. She said, take it cool. And here, look at her. She's also equally cool on the face, right? Thank you, ma'am. And she has a 26 years of experience in military nursing service. She has a background of military nursing services. So she has 26 years of experience. So with all these experiences, let's now celebrate the World Health Day. Now invite Dr. Agrida Babu to please deliver the keynote address to participants.
Bharti, please introduce that our
Ma'am Shikha Malhotra, I was not able to see. Yeah, whether ma'am she has joined? Madam is not, I joined, I think so.
Yes, I have joined, and my video is disabled by the host. It's saying here.
Ma'am, I've yes, here is Madam Shikha Malhotra. Ma'am, I have the pleasure to invite you over here. Madam is a nurse actress. Oh, let me share you some screen of hers. I mean, we have such a beautiful madam over here. So let me share her.
Thank you so much for inviting me today. It has been
ma'am, you were there last year, and you promised us we're nurse ambassador for our country, isn't it?
Yes.
Yes. So we do have a pleasure inviting you. And let me share the screen.
Already here.
People know about it. That Madam is a nursing officer and an actress also. I think today in some live YouTube, you would have seen Katrina Kaif has, appreciated you a lot of being a nurse and how you supported her. So we have some pictures over here about Madam. Madam Shikha Malhotra is an actress as well as nurse. Everybody knows it, isn't it? Now let me show you some of her photos with Shah Rukh Khan. We'll call her as a nurse actress. She has completed her BSc Nursing honors from College of Nursing, Safdarjung Hospital. She's very talented person, like dance performer, and she's a singer, yogi, swimmer, painting, reading, and many other talents with positive. Ma'am, thank you, madam. Not only the actress and nurse, but she has a multi-talented personality. She has volunteered herself to work as a COVID warrior in Hindu Hidas Mamrat Hospital, Mumbai for around 7 months. She became COVID positive herself and even recovered recently from a stroke. So thank you, ma'am, to be a COVID warrior and helping the humanity over here. Thank you very
Thank
much.
you, Bharti ma'am. Thanks
Yeah,
for
thank
such a beautiful introduction. My pleasure to be here.
Thank you. And now let's request, I'm sorry, because of your coming over here, we could not do it. Now I request Dr. Girdhar Babuji to please deliver the keynote address to our participants.
Can you see the screen, ma'am?
Yes.
Thank you.
Thank you.
Good afternoon, everyone. I'm extremely grateful to the Indian Nursing Council, the president, the vice president, and all the office bearers for inviting me to be part of this wonderful celebrations on World Health Day. The reason I call celebrations is because the theme of the World Health Day is to create a fairer and healthier world. And in order to do that, what better to think of the Nursing Council and the members of the Nursing Council. As doctors, we have learned most of our basic skills from the nurses. So, and they're at the forefront in terms of service delivery, compassion. Equity is something that you learn from this empathetic view of the nursing profession as such. So salutes to all of you, and thank you for inviting me. So at the outset, I would want to make a distinction between these two terms in terms of equality and equity. So as you can see, what equality means is you are giving similar opportunity to everyone. But it will not be enough for some sections of the society and some people, even though you have given them equal choices. What equity, on the other hand, means that you take care of those who deserve probably better treatment and prioritization compared to those who can afford access and also have sort of available services. So this is the theme in terms of the distinction between the health inequity and the health inequality. When we look at redressing health inequities, we need to address unjust differences in the health between persons of different social groups. And this is a very normative concept, which means it's very difficult to measure unless we make specific attempts to it. Whereas health inequality can obviously be measured easily, and then also will be able, for example, we'll be able to address the difference in terms of regions or in terms of some social groups. So where do these inequities stem from? Why is the inequity in the first place? So to begin with, if you look at the kind of infrastructure in the public health settings, from the GDP's allocation of resources to public health, if you see where India is in terms of 3.5% compared to the other countries. Even among this, the proportion of money that goes into the curative health services is far greater. So when equities is not the focus of any health allocations, then the systematic inequities built even from the very beginning of health planning as such. This you're all very familiar in terms of how many nurses and doctors per 1,000 population. And you would see in this also, India does not fare well in terms of what the optimal levels are. While India might be having the most skilled nurses in terms of their education and capacity, when it comes to deploying them, ensuring their career progression, and also ensuring that they're well protected in terms of career growth, I don't think India fares well. If we would have fared well, we would have had all our nursing profession flourish in this country. Although the same thing can be true for physicians, for the sake of better salaries and better resources, most skilled professionals will have to go to other countries. In contrast to the kind of powerhouse of how human resources are created in the country, if you look at the health burden, we are not in a great shape. If we forget for at least a moment, although it is very difficult, that COVID-19 has sort of surpassed all the health crises that we have, but the background health statistics reveal that we are having the highest burden of non-communicable diseases, be it hypertension or type 2 diabetes mellitus. In the next 8 years, we are going to be the capital for all these NCDs, and it's not a great thing to be boasting ourselves. With diabetes over 101 million and hypertension more than 240 million. Just to put in layperson terms, 1 in 3 adults have high blood pressure. Instead of addressing the hypertension as a public health problem by detection and then ensuring treatment to all of them, most of the governments are pumping millions of rupees. After 10 or 15 years of somebody being hypertensive, they get myocardial infarction or a stroke, then there is money provided to the private health facilities in terms of treatment for it. So just if you pick up one disease, there's so much scope for understanding the poorer people who do not have the access to health services. So if you imagine one such person who is having hypertension, that person will never be detected with hypertension till that person gets either stroke or any other complications such as myocardial infarction. So inequities exist in the way the health services are administered, although not as a default, although not it is by purpose, by the sheer structure, design, and the mechanisms of health service delivery, people who are vulnerable, people who are in the remote areas, people who belong to vulnerable groups are deprived of these minimum services. We have done um, really well in terms of reducing the maternal mortality and the infant mortality, but still it's not comparable to some of our neighboring countries. So when we take pride in definitely having this ambition of being a superpower at some point of time, we need to be addressing this. Without addressing the inequities, we can't actually reduce the last mile is always the difficult. So far we have done, thanks to again the nursing profession in the role that you have played in reducing the maternal mortality and infant mortality, but the last bit of the struggle is definitely difficult without addressing the inequities. Where are these inequities existing? If you look at something like as simple as immunization, there are differences between regions. Even within a state, there are differences between the intra-regions within the state. Even within a district, there are places where coverage is better and the coverage is bad. Same thing with the socioeconomic status, the place of residence. These are the simple but powerful determinants of inducing the inequities. In terms of curative healthcare, you would see that the way our health system is utilized, if you look at percentage of utilization, the richer the people, the higher is the likelihood of using private facilities. The reverse is also true in terms of the poorest having only public health facilities as their only choice. The irony is these health facilities are mostly in rural areas, and in the urban areas, there is not comprehensive primary health care, at least as of now, which are available for poorest or the poor in the urban areas. So while the public health services are doing their best in terms of quality, there is scope for improvement. Why should we really worry about inequities? Why is that we need to focus on health system? This is not appreciated well, but if somebody is not poor in this country, the number one reason for becoming poor during their lifetime is because of catastrophic healthcare expenditure. And this, if you can see, 28 of all the rural areas, 20% of the people in the urban areas do not have funds for healthcare. So God forbid there is any emergency, there's no money available for taking care of their health needs. As a result, over 40% of the people who are hospitalized have to borrow money from others, mostly at the high interest rates if they can afford, or they'll have to sell their assets. So this is the number one reason for inducing inequities where it did not exist in the beginning. Unless we have a strong public health system which takes care and ensures universal health coverage is improved, it's very difficult for not just for the poor people. Poor are already poor, but we are adding a new class of impoverished community because they had some major illness in the family. So this is not imagination, but the real data which says over 35% of the hospitalized persons will fall below the poverty line because they are hospitalized and they have to pay the medical expenditure. With this in the scenario, the ideal approach should have been focusing on the maximum in terms of ensuring our communities are healthy. And in order to make communities healthier, we need to be engaging with the community, empowering them in terms of the resources, ensuring that the determinants of health, we all know what the definition of health is. In that is embedded complete physical, mental, and social well-being. And that is the biggest missing piece in terms of addressing inequities. If you don't change that, the feeder pipe of illness will continue. The next big chunk of our focus has to be towards preventive services, health promotion, and well-being. And if you have 1 rupee allocated from the budget, the top two slices of pyramid should ideally have taken 70% of it, and specialist care should be taking only a minor proportion of it. This is ideal. But what's happening in terms of the spending, that the money that we are allocating, most of the money goes to specialist care. I'm including both public expenditure and the out-of-pocket expenditure. If you combine both together, most of the money spent is towards the tertiary illness and taking care of curative services. Some of it is spent on preventive services, mostly on immunization and antenatal care and things like that. And a tiny bit, although I've shown a bigger slice for housing, social care, and the other determinants, it is much tinier than one would imagine. So everybody wants to help a health system. And this is my favorite slide when I teach public health. The way health system gets help is something like this. We have experts, we have international agencies, we have bureaucrats, politicians, everybody is trying to help, and none of them are actually strengthening the system. They would want the same person to get strengthened as much as possible and continue and complete all the work. Just to give you an example, during COVID-19 crisis, the same set of health workers are supposed to do testing, contact tracing, COVID-19 vaccination, with all the other services that they're delivering. This is not strengthening health system. In order to address inequities, health department alone cannot do it. And unless people realize the role of health for every department and every sector, an all of society approach is what is required rather than overburdening the health system. This has to be ensuring in terms of access for everybody, reducing the cost, and ensuring that the behavioral and cultural factors are addressed. There are some challenges in some terms of both supply and demand side. From the supply side, we'll have to make sure that there is enough resource allocation. We need to be really speaking as a passionate advocates for scaling up the allocations for preventive services. And that's where a better future for most of the LMICs is there. physical access and human resources. I think how much ever we stress on this, it's less. India thrives because of the investments made in the A&Ms, nurses, and doctors, and all the people who are working in the periphery. But it has stopped at some point of time. There is no career growth for most of these people. There are no expansion with the expanding population. This needs to be the top priority in terms of supply side. And ensuring quality at every level will remain as one of the important factors. On the demand side, we need to make sure that people do not have financial constraints. As I said, if impoverishment is such common amongst middle class, how do we prevent it? How do we ensure inflation is adjusted? How do you ensure behavioral factors? Without going into the details of the metrics, what needs to be done, there has been a lot of work on this. And as a result of that, uh, I'll just focus on this. As a result of this, the high-level expert group constituted by Planning Commission advocated for universal health coverage for India. So this is the way forward, and many countries have done it. This is the time India adopts it. I simply adore the definition of the UHC by the Commission. The high-level committee said ensuring equitable access for all the Indian citizens, irrespective of where they live, what kind of income they have, what is the socio-economic status, religion, gender, to accountable, affordable, appropriate health services of assured quality, as well as public health services addressing the wider determinants of health, delivered not just to individuals but the populations, with the government being the sole guarantor and enabler, if not the sole provider of services. I don't think a comprehensive definition can be obtained for universal health coverage. So universal health coverage implementation is the way forward for it, not the current system of affairs where everything is burdened onto health system, and then the health system is supposed to function on its own without much of the support. So I would like to use the quote of the regional director for Southeast Asia Regional Office of WHO in the editorial commentary today. Uh, this is a very phenomenal thing that the RD has informed. We should remember on this World Health Day that COVID-19 is just one more disease which has exposed and exploited and how the inequities are exacerbated in the society. And how do we address this without actually addressing the socio-economic positions and the other determinants of health is the point we need to focus right now. So with this quote, I would want to thank all the nursing professionals for their immense role in delivering universal health coverage. The reason I say this is, if you were to deliver universal health coverage, there is no way only physician-led services can achieve this. You are already seeing in Karnataka state, at least there are health and wellness centers which are sort of led by the nursing professionals after completing a prescribed course. So having nurse health practitioners, having nursing health officers of different cadre, having a dedicated cadre is the way for going ahead in terms of implementation of universal health coverage. I'm a clinician, I'm also epidemiologist, but there is a limitation to an extent which physicians can play a role in terms of implementing UHC. As a result, there is scope for ensuring that many people, especially from the nursing profession, they also need to be trained in some of the subspecialties and contribute to overall scenario. Public health is an integral element, and more nursing professionals should enter into the public health in terms of public health practice, policy, and research to deliver universal health coverage. So just before I say thank you, the nurse health practitioners are phenomenal addition in this journey. not just in the critical care, but also in terms of delivering comprehensive health services and to address inequities in the system. And thanking all the nursing professionals once again, I would like to express my sincere gratitude for having me invited for this important meeting. Thank you.
Thank you very much, sir. It was a lovely, I mean, very, very informative keynote address for all of us. But before I request the participants to ask the question and answer, if some speakers would like to ask any question to Dr. Girdhar Babu.
The way he explained, everything has been so crystal clear and very good explained. I just want to thank you so much, sir. When we hear about nursing practitioners, people, there are not much of a people who really know what efforts they put, what we go through. So the way you heartily appreciated all the nursing practitioners, I'm really thankful to you, sir. Thanks for giving so much respect, so much love to all the nursing officers or nurses in all the ways. Thank you so much.
Thank you, ma'am. I'm not saying this just for just because I am attending a meeting with the Nursing Council. This is heartfelt, and we have seen what kind of progress has already been made by involving the nurse health practitioners.
Thank you, sir. Thank you so much.
President, sir, you would like to ask any question, Dr.
No. Let participants, anybody would like to ask any.
So it's not an interactive session. I have to read out the questions. We have not received many questions as of now.
Okay.
Ma'am Savajit Kaur, would you like to ask any question to sir?
I would at the outset thank Dr. Girdhar for taking such a detailed presentation. And sir, you are an epidemiologist, so my question to you will be in that regard. We were just wanting to know that being there at the grassroots level, where do you see the nurses contributing towards a better and a fairer world from the nursing aspect of it? What do you suggest any roadmap, say 10 years down the lane, how to move towards this goal?
I think I cannot see a path without nursing professionals at the helm of the affairs. If you were to imagine a hospital, I'll just give you an example. If you do not have the nursing services there, there is no way the hospital will maintain the quality. Same thing with the primary health center, same thing with the health and wellness center. So it's not just one aspect of healthcare services that the nursing profession is taking care. When I say inequities, at a level of health and wellness center, there is physical activity, yoga being taught, counseling is being done, and all of this is done by the nursing professionals in the health and wellness center. So what better way? And they are also the leaders for the ANMs and the ASHAs. They understand each other, and definitely women power is at a real implementation there, where I'm not negating the role of men at all. I mean, we might have some role, but it is the leaders in the ground level who are delivering this. So I think the clear path is to see that the nursing profession emerges as the leaders in implementing redressal of inequities, making sure that comprehensive health services are provided. I think, again, this is an opportunity where India can show the path for many other low and middle income countries also.
Thank you, sir.
Thank you, sir. Any participants who would like to ask the questions and answers, you have Q&A mode. So I'll be there for a minute. If you have any questions, please ask, but related to the subject.
Yeah, Bharti, we see around 59 participants have raised hands. Maybe you can ask them to put it in the chat box or in the question answers.
Yes, ma'am, I saw that. It's all good afternoon. So, ma'am.
They're raising hands. 65 participants have raised their hands, I can see. But then if they can put their questions there in the question answer box.
Dr. Girdhar Babu, this is I think you are many of the channels they are asking our expert questions on the COVID 19. I think why can't you just how the vaccination, the role of the nurses in the vaccination, and what are some of the bottlenecks what we have in the delivery of the vaccination process, because you are the one who, in the polio vaccine way back in WHO utilized your expertise. If we can little dwell on upon COVID-19, some of the important issues, so that our participants will be knowing about the technical issues in the COVID-19.
Thank you, sir. Uh, if I have to summarize the situation now, the second wave is of really of great concern. Uh, we'll have far more higher number of cases compared to the first wave. The only way to beat this is in ensuring that the vulnerable persons in our communities are vaccinated. And here is the role for the nursing profession. The first need is to vaccinate themselves because they are the people who are protecting the community. The next step is to ensure the vulnerables are protected. There are ANMs, there are ASHAs, take their help in terms of mobilization and having outreach sessions as permissible within the state government norms. But we need to ensure that the next 2 months, we vaccinate all those vulnerable people because 100% protection against death is what is the guarantee by the vaccine. Vaccine doesn't prevent infections. It prevents death. It prevents severe illness. If, and again, as I said, starting from intramuscular injection, all of us doctors have learned it from the nurses who have taught us. Who can better than the nurses who lead the vaccination program? This is the need of the hour that the nursing profession takes the lead in ensuring vaccination is done at a much higher pace compared to what we are doing now.
Thank you, sir, Dr. Giridhar Babu, sir. We have one question from the participants. In India, there is diversity in each aspect. Political influence in every aspect is high, wide differences in poor and rich. How is it possible to build a fairer and healthy nation?
Where there is a will, there is a way. And all of the dignitaries here have worked with the political system and have accomplished so much. When I look at the president of the Nursing Council, I have not seen many countries implementing the reforms that the reforms done by Indian Nursing Council. So how is this possible if political interference was only a major threat? So if he's able to do it, then I'm sure we have a lot of things to learn from sir. So when we want to do something, I believe in Paulo Coelho's quote, if you want to do something with a good heart, the entire universe conspires to help you. So put all your might and then do, I'm sure we'll be able to do it.
Wonderful. Yes, true.
So there is one more question. It is of this theme. It is about, is this necessary to take vaccines against COVID-19? Because after taking the vaccine, also some people have corona. So whether these vaccines are useful, whether we have to take.
Yeah, so this is the thing I told earlier also, but it is good to repeat as many times. After taking the vaccine, there is no guarantee that the infection will not come. Let us understand, I mean, you're all much well learned. Once the virus enters, it replicates. Where does it replicate? In the nasopharynx. The vaccine doesn't prevent the virus from lodging in the nasopharynx. But what it prevents is how the body responds to this infection in terms of severity and death. Therefore, what vaccine protects is against death. It is against severe illness, not against infection. So if some people get infected and get tested positive, that's not the failure of the vaccine. It only means that despite of this, they did not get severe illness. And this is 100%.
I know these are the questions coming to all their minds. And we have one more question. I mean, it's very, practical question, but I don't know how do we address that. I think, yes, sir. So on the level of care provided by the nurses at community level, what are the steps to improve equity in health services other than normal programs and immunization?
No, I think that's a great question. And health and wellness centers look at comprehensive addressing of the determinants of health, not just immunization or antenatal services. And where opportunities exist, no, I mean, currently, let's be practical. Doctors are not going to health and wellness center, it's sub center. Other professionals are not so happy to go there. There is an opportunity there. Once we show that the nursing profession are the leaders there at the health and wellness center by addressing all the determinants of health, then you open up plethora of career opportunities at every level, urban level and state level, national level. But we need to begin at the health and wellness center, and that's a perfect lab for ensuring equities are addressed.
Thank you, sir. And I don't think we have any other many questions over here. As we know that India is a developing country, our large population are working in industries in India. There is no any course for occupational nurse. I'm sorry, this is not the thing. I will not take this question. I mean, please ask the questions on today's theme, not on your personal questions.
Bhati, there's one question I think as an epidemiologist, does Sir think that the vaccination program needs to speeden up? Do more people need, or is this good enough?
Absolutely. I think it has to be uh, faster, at least 5 to 6 times. We are doing at the highest 4 million doses per day. We should be at least doing 10 million doses per day.
Oh, oh my God.
That's true. I think we have crossed only 8 crores. I think it's only 8%. 8% of our population. Yes, huge population, many issues, but still we are able to tackle this. Isn't it, sir? With a positive note?
Yes, a huge population, but our accomplishments are also not less.
Yes, that's
In terms
true.
of polio eradication and other programs, we have shown the world how India can deliver, and the same model is replicated elsewhere. I think we need to regroup ourselves and then make sure that we are successful at again.
I think today's newspaper said, apart from China, because we don't have information, we are the first country to come with so much of vaccination, that is 7.82 crores. I mean, that we have to applaud our country for that, and our nurses basically. I mean, they are responsible for all the vaccinations over in our country. I don't know whether to take this question, but I think you can take a call on it. My question is that the healthier are more in richer citizens than poorer. So is this based on poverty? I mean, the health is correlated with the poverty.
Poverty is a very powerful determinant of health and health services access and it equivalent. But to think that richer are healthier is also not true.
That's
So
true.
these are two extremes, and
Hmm.
poverty alleviation or reduction in poverty is an important determinant for ensuring healthy communities thrive.
I think compared to any other countries, I mean, we do have a lot of public relation, more in health organizations compared to any other countries rather than private. I think that we can explain to them because people have the say that because access to health is there, but thing is people need to go to hospital on their own. Like for vaccination, I think you're all telling them go and get vaccinated. People are not going on their own for vaccination. They have been pushed and they've been made some other how to go about to these a lot of companies going up on the vaccinations. Can you just elaborate on that, sir?
No, to expect people to go to health facilities is a problem even in developed countries. There are to be a better communication efforts in terms of understanding and explaining the benefits of vaccination. And for all our vaccination programs, the vaccination sites were nearer to their families. Expecting somebody to travel to really further distance for getting a vaccine is not really easy. So from the top down approach, we need to change into bottoms up approach in terms of micro planning, mobilization, so that the vaccination effort is enhanced. And that's where states have to take that leadership role.
Bhati, you're muted.
Thank you, Dr. Giridhar Babu. I mean, you have been very, very busy, and especially in the media now, but still you took out the time for us and today with us in this platform. Thank you very much, sir. We'll appreciate coming over here. Thank you very much, sir.
Thank you, everyone. Thank you.
Now I request Madam Shikha Malhotra to address the participants and tell your experience about being a COVID warrior. I mean, that is what we want to hear from an actress now.
Yes, why not? It has been so different for me, like another life. So, first of all, hi everyone. I have seen so many participants writing that they're from so and so nursing colleges around the country. People are joining in here, and thank you, Sarabjit ma'am, Dilip sir, Bharti ma'am, everyone who always calls me in such kind of interactive and informative sessions. I be so glad to be here today. So I'll just start from where I've been and how I came here and what all were my experiences in short. So as I'm a born and brought up from Delhi, and I'm a nursing officer first, then an actress. So it has been a great journey playing both the roles. So certainly I got the chance to play another character after being an actor. Again, I have got the chance to play my role according to a nursing officer through the serving people in the global pandemic. So I'm born and brought up from Delhi, and I've completed my BSc Honors Nursing degree from Vardhaman Mahavir Medical College and Safdarjung Hospital, which has been a great journey for me. My training time period was so exciting, treating so many patients in different kind of mindsets and meeting different people. I'm since always very interactive and very, talkative. Uh, but after finishing my degree, I came to Mumbai in industry because since childhood, when I was 3, I started dancing, and I'm a trained classical dancer, trained classical singer, painter, writer. So in short, I'm an artist. So I had to do, something out of the league. People used to say, how a nurse, singing, dancing. So there is no definition of a nurse. Nurses are the most creative, creative, I think, people on the earth. I see many nurses doing different things, and we play a role of a mother, a daughter, every kind of role we are playing in our field. So it's not easy to be a nurse. So after coming in industry, I worked with Shah Rukh Khan. I've recently come up with my film Kanchli, and suddenly the PM Modi announces the country lockdown. So I decided, when all the actors are sitting at home locked inside, I have taken the oath and I have this degree. So if I sit at home, it's like having a weapon and getting scared of going into the war. So believe me, I didn't give it a second thought. And within a second, I decided, I took my degrees and I started roaming in Mumbai even after the lockdown, and searched the hospital, Hindu Hriday Samrat Bala Sahib Thackeray Hospital in Jogeshwari, and started serving from 27th March, just after 2 days of the lockdown. Because my mother is also a retired nurse in Delhi. She got retired in July 2020. She served for 5 months at the age of 60. So it was a great inspiration for me. And being an actor, I always think that I'm a nurse inside. So I'm always, even on my film set, I gave injection to my director, to my actor, to my co-actor. So I'm always a nurse inside, and I keep on, injecting people, doing dressing, and they don't need a doctor on set. So, okay, when I first day entered the hospital, I got to treat a COVID patient, and my journey has started. I worked in COVID ICU. I have been asked to, to shift myself into normal wards, but I said no, that I have joined it voluntarily without any salary, because being a new actress, I don't have crores to spend, but I have my degree to stand with the country. So I started working in COVID ICU continuously for 7 months, treating 7 months COVID patient, 288-year-old Charulata Aji. It has been a great experience. Seeing patients going home, and the best thing which I've done from my part is counseling the patients, because I use my skills that I'm very good in talking. I'm very good in consoling people, and I'm an actress, so I know emotions. I know emotion, how to, catch the emotion, how to talk to people, and how to, uh, excite them to say whatever they want. So I help people to open up, because at that time, at that very point of time, it was really difficult to stay alone in the hospital. You were not allowed to, still in COVID wards, you're not allowed to see your family members. So everybody was so scared. And I did the best thing, that every day I used to go to the ward and I used to talk to the people, the patients, for hours and hours, and tell them not to get scared. We nurses are your sisters, your mothers, your daughters. Don't worry. So my hospital made me a nursing counselor at a very early stage, just after 2 months. And I gave them idea to start yoga sessions, because I'm a yogi also. So I started yoga sessions into my hospital, help them to do the breathing exercise as much as they can. And all these kind of ideas, as a young nursing officer, I tried to implement on what all best we could do. So I think my journey has been so exciting in all those times. And I myself was staying in Mumbai alone without my family for 1.5 year. All those, during all that time when I used to go to hospital, and sometimes I'm treating a patient and next day I'm going and seeing the empty bed, was really heartbreaking. So again, I used to come back and gather all my heart to go back again, because I used to think that, okay, a nurse can nurture, a nurse can win the heart, a nurse can, give warmth, give love. So that's what I know in my inside of the heart, that what a nurse is. So I think it has been a great journey. And after that, in October, I myself contacted the virus. So after getting recover, in 1 month, I got brain stroke and right side paralysis attack. My face was right side deviated, but I think lots of wishes I got from around the world. And I am here now again, fine, being a part of this webinar today. And I think I want to tell all of you that all the nurses, all the young nursing officers, that believe me, we are born to support and help each other in whatever best way we can. So there is nothing, to be scared of. It's only the will. Where there is a will, there is a way, as Girdhar sir says. So I think we should just join hands and do our best, into not only in COVID, in global pandemic times, wherever you are, in whatever situation. So all my best wishes to all the nurses and everybody out here, who have been doing their best. And I have seen all the nurses, all my seniors, and working tirelessly, continuously for hours and hours, wearing kit, and it's not easy. It wasn't easy. So I'm always, a nursing officer first, and you'll see me in future also working as a nurse, as a counselor. Now, even whenever I get time, whenever my schedule allow me, so I'm always, address myself a nursing officer and counsel the patients, counsel the people normally wherever I can. So thank you so much for calling me today here. It has been a great honor to share my experience.
Thank you, ma'am. Thank you, Shika Malhotra, ma'am, so much. I mean, we all have to get motivated from you. I mean, you had COVID, you had stroke, and you're back, and with all the charming smiles, and I mean, that's a willpower. What you said is that the takeaway from today's show is a willpower,
That's
and
what I
and to
shared with
serve.
all the patients.
Yeah, yeah.
I shared my smile to them. I gave all my smile, all my love, all my heart to them. And one more thing, achievement which I achieved as a nurse, that I have just endorsed Volini Gel as a brand ambassador. And the important part is that they made nurses the hero of their Real Hero series. So I worked in that ad as a nursing professional, not as an actress, just Shikha Malhotra as ICU nurse. So it's an achievement to become a faces of nurses, so that I can just be a brand ambassador around the world, and I can just cherish as much as I can my nursing fraternity. So it's my pleasure.
Yeah, ma'am, you are truly a nurse ambassador. I mean, yes, I think all the young officers today who are participants over are motivated from you. At the end, the takeaways, have a willpower and serve the community at large how much you can being a nurse. Thank you.
Yes. Thank you. Thank
so
you.
much.
Can
Thank you so
can
much.
we? You
And
said you are a good singer. You said you are a good singer. Can we have
Yes.
a one-liner motivating song for our
Why
nurse
not?
community?
Why not, sir? Why not, sir? It'll be my pleasure. Let me sing. ये हौसला कैसे रुके, ये आरज़ू कैसे झुके, मंजिल मुश्किल तो क्या, धुंधला साहिल तो क्या, तन्हा ये दिल तो क्या हो, शाम छुपा ले सूरज अगर, रात को एक दिन ढलना ही है, होगी हमें तो रहमत अता, धूप कटेगी साए तले, हिम्मत 100 बार रहे, ऊंचा इकरार रहे, जिंदा हर प्यार रहे हो, ये हौसला कैसे रुके, ये आरज़ू कैसे झुके.
Thank you so much. It was a lovely one. Very lovely, ma'am. I mean, you are really talented, multifaceted personality. I know. I mean, it's very rare to have. Thank you so much to be on our platform
Thank
today.
you, ma'am.
Thank you
Thank
so
you so
much.
much.
Thank you so much.
We are very proud of you because you have excelled yourself. No way nurses are inferior. You have shown and the talent. I always told many people in many of the policy meetings, nurses are the good counselors. I think it
Yes.
came out from you now. Nurses are the good counselor. So it has come out from you that you are a good counselor. So we have that techniques we have learned during the course of our graduation. That's good.
Yes,
I
sir.
think we can counsel them, and definitely with you, we have a more visibility of nursing profession in the eyes of the public.
Yes,
Thank
sir. Yes. Thank you, sir. Thank you so much for all the respect and love. Thank you.
Thank you, ma'am. Thank you so much. I think we're short of time now, but we'll still will not take much of the participants' time. So now, do I request Dr. Asha Sharma to launch the e-learning for the COVID-19 today?
Thank you, Bharti. I think before launching, maybe from all of us, and maybe in other words, the whole nursing fraternity, we would like to thank Shikha coming over here, and especially extend our gratitude and heartfelt applaud for your participation in COVID-19.
Thank you, ma'am.
Giving your acting work, and you wanted to utilize this opportunity. Thank you so much for not forgetting that you are a nurse, and nurse is everywhere needed, no? And as you
Yes,
have said,
yes.
in your sets you are required, and you've been doing so. So thank you very much for uh, uh, taking part in COVID-19 and continuing to be counseling people on health matters. Thank you.
Thank you, ma'am. Thanks for your kind words.
Uh, as we all know that COVID-19 pandemic, which is still on the rise, and especially the second wave is of great concern to India, although it is on the third in the list, in terms of its spread, but people are still scared, and health workers are doing their best. And I think we have to reaffirm our gratitude, and as well as applaud for all the health workers, especially the nurses, being there round the clock for taking care of the COVID-19 patients, risking their life, and with all precautions taking over there. You see, when the COVID-19 spread started, this was an infection which was not known. And so somehow people were not aware as to what to do and how to prevent and how to treat these people. So initially the nurses in their health facility itself, by their health authorities, they were whatever knowledge they were given, and they were asked to follow some precautions and protocols, they carried on. But later, I think our nursing community really took very active part, especially from the Indian Nursing Council. We started initiating the webinars on COVID-19, taking care of how to, what it is, how it spreads, and how to take care, what are the precautions, what are the protocols to be followed. And series of webinars were done, and I think lots of nurses really participated in these webinars. And not only INC, I think many nursing institutes, colleges of nursing also started arranging, having these webinars to spread the knowledge about the COVID-19. So I'm sure that seeing the number of webinars which were held, we all felt that why not we have something, some learning material, which all categories of nurses, whether they are in service, whether they are teachers or they are nursing students, they should have some ready reference. So the Indian Nursing Council um, felt the need to develop a e-learning module on COVID-19. So which is done now, and it's ready for launch. So I would request Dr. Sarabjit to share the screen. And I'd now like to launch the e-learning module on COVID-19.
Wow, that's a great thing, ma'am.
Thank you, Sarabjit. And I think so you are familiar now with this module, and it is ready for its use by all nurses, whether they are teachers or they are in-service nurses or the nursing students. Thank you very much. Thank you, Sarabjit.
Thank you, ma'am. Can I request Dr. Shavajit to please explain on this e-COVID learning, e-learning of the COVID-19, I'm sorry. Yeah.
Thank you, Bharti. Thank you, Ma'am Asha, for launching this e-learning course. This is course number 1, which has been launched by Indian Nursing Council. And basically, it's going to deal with the role of the nurse.
Ma'am, your screen is not shared.
I'll just share it.
Okay, thank
I'll
you.
be doing that. Thank you. This module that we have prepared is this course number 1 for basically describing the role of a nurse in infection prevention and control of COVID-19. The course duration is for 10 hours. It has got 2 CNE credits, which is equivalent to 10 CNE hours. The main course aim is to upscale the training of nurses to enhance their preparedness during this COVID-19 time and to boost the nurses' knowledge and skills related to COVID-19. So I'll quickly share the screen with you. Please give me a minute. Are you able to see this?
Yes.
Yes, yes.
Thank you. Thank you. The learning objectives of this learning program that's going to be on the INC website next week onwards. It is going to help the participants to describe the epidemiological factors of COVID-19, as well as identify the role towards detection, early detection, and prompt referral. We're also going to explain the various World Health Organization and Ministry of Health and Family Welfare recommendations for infection prevention and control, as well as demonstrate understanding of home care for patients. This module, as you can see, it has 4 modules. Module 1 for 2 hours, Module 2 for 2 hours, and Module 4 is also for 2 hours. Module 3 is 4 hours, making up a total of 10 hours. The first module talks of the facts and myths of the coronavirus, It's epidemiology, causes, symptoms, diagnosis, treatment, prevention, and myths. The module 2 for 2 hours speaks of preparedness, readiness, and response for COVID-19. Module 3 is focusing on infection prevention and control for COVID-19, and it also deals with topics like standard and transmission based precautions, hand hygiene, and the personal protective equipment usage and care. Module 4 is on home care of patients and various guidelines regarding home quarantine. As you can see at the top, in order to use this module, the nursing officers, the nursing students, they'll need to register themselves. The registration is very simple. It also consists of just certain guidelines, also including your details, your email ID, and the institutions where you're working. Once you register, then you can easily log in and complete these modules. As you can see, this is the registration page into which you'll be filling up all your details. Please don't get worried about the NUID number because this is not a mandatory field. If you have it, please fill. If you don't, then you can omit it. You'll get registered with this. Please remember your password for this so that every time you log in, you'll just need to then go into login and put in your email and your password, and you can be there for the modules to finish them. The advantages is that sitting at your own home or in your work office as per your free time, you can complete these modules as per your own time and your own convenience. As we have told before, that there is going to be a certificate for this, and also here it's mentioned very clearly 10 CNE hours. But then again, because it is consisting of a pre-test and a post-test, you have to remember that it is mandatory to get 70% for successful completion of the modules. The certificates of course completion and credit hours will definitely depend on this achievement of 70%, and it will automatically be made available on the INC webpage as we've been doing for other virtual training programs. So this page that you see, please look out for this on the INC website. Starting next week onwards, please register yourself so that you will be able to equip yourself with latest information. We all know that knowledge is a treasure and practice of that knowledge is the key to it. So at INC, we all hope that more and more of nursing officers, nursing students will benefit from this e-learning module and will continue to contribute in your own unique way to build a fairer and a healthier world, which is the theme for the WHO this year. Thank you so much. Over to you, Bharti.
Thank you, ma'am. Thank you so much. I think our participants have listened to you carefully and would be able to do the e-learning from the next. I think you all know about NRTS, isn't it? For the renewal of license, it's mandatory now. So every 5 years, you need to have a renewal of license. And this is coming from the national portal. So you can always utilize this e-learning modules for strengthening your CNERs. Thank you very much, ma'am. President Sir, can we launch?
And it's always a pleasure to hear you, Sarab ma'am. It's always the way you explain, and it's so polite. I mean, I love to hear you.
Yes, that's true. That's true. Thank you very much, ma'am. We do acknowledge that. Yeah.
Thank you.
President Sir, I would like you to please launch the website.
Okay. Yes.
Just a second, sir. There's some problem. I think there's some technical problem. I think you have just launched it. I mean, there was not a curtain raiser. Yeah, this is our new website. Present, thanks, sir. Thank you very much for
Wow,
opening
beautiful.
our new website. It has a new facelift, like we have a nurse office and an actress like that. We have chef lift now. Now this is a new facelift for our website. So, President, sir, would you like to say a few words on the website?
No, I think I think the computerization is one of the objective which the Indian Nursing Council started way back, so that now whole functioning of the Indian Nursing Council, you can even the executive committee decisions and the list of institutions, all the circulars. So we are able to communicate to all the nursing education institutions and to our faculty. Now we have reduced the posting of the letters. We are putting all the individual letters. Each institution can access their own institutions letters in terms of the whatever the communications which we are sending with regard to the suitability of their institutions, and even if they have a deficiencies, they can put their password and access their letter, and there's no need to wait for a letter from the Indian Nursing Council. So we have made the user friendly and also the transparency, and to improve the communication. I think still we are a long way to go some of the objectives which are laid in, and the so that we can reach out to the nursing fraternity through this website. So therefore, I think we had our website, and I think Bharti, you can explain what all some upgradations we have done with this new website.
Thank you very much, sir. Let me introduce myself first. I think I was not introduced today to the participants. I am K.S. Bharti, Joint Secretary of Indian Nursing Council. So let me now introduce to our website. I think you all know our website was there and it was quite dynamic. The same thing, not much difference. But yes, we want to tell you, we want to inform everybody that we have gone to Digital India. I mean, you can see the power to empower in Digital India. That is there, the logo. Now we're all with the e-governance. As sir said, we do not want any hard copy. So we, for the students verification also, we are, I mean, institution verification also, we are coming, we are going live within a week. So in the such manner, we are, this website is quite dynamic. You are requested, all the teachers are requested to look into our website. You know, every day something new will crop up. You are requested to look into. You have to go through each, because I'm not going to tell you, inform you, otherwise I'll take an hour to tell us about our website. So I know you don't have so much of time, but yes, now when you go for an act, if you go for Indian Nursing Council Act, if you click on it, you will have an Indian Nursing Council Act, right? So like this, if I you can download our act, so you don't have to ask anything, right? And if you go for virtual training now, as you all know, Indian Nursing Council having a virtual trainings for the capacity building of midwifery teachers. So this is what you can click on, and you can look into, because you're going live, maybe this is the dates, I mean the certificates, the virtual training conducted, so you can have a certificate download from here, from the INC UNFPA virtual training. And as sir said, there is always, I think you're all aware of the Nursing Now campaign. If anybody wants to look into that or attach that, you can look those Nursing Now campaign. So now, like universities offering recognized nursing qualification, we have many deemed and private university which are offering various nursing programs. So I just want you to look into it. This is the universities, and any universities which want to, want to be a part of the schedule INC Act. I mean, they have to be a part in the schedule of INC Act under Section 10. Otherwise, the qualification given by them is not a registrable qualification, right? Awarded by the universities will not be a registrable qualification. It's very necessary for the all examination boards to be recognized by Indian Nursing Council under Section 10. Look at that, universities and boards have to be recognized. So if you want to look into whereby universities recognized, you can look at, see some of the older universities, the government universities, all they're in the act, right? So we have added on those Schedule 1, Part 1 and Part 2, because our act is 1947 and many universities have come later after that. right? So even like, for example, PhD, you want to look in, just look into our qualifications, this higher addendums. You will look into whether this university is recognized for PhD nursing program. We are coming out with so many university offering PhD nursing program, which is not recognized by Indian Nursing Council. So then you will have an issue getting it registered in your as additional qualification. So be careful while registering before registering the PhD qualification, right? And then we have nursing programs. I mean, types of nursing, what all we have, all these nursing programs you have, right? And we have publications. So anybody wants to have a publications, you don't have to ask कहीं से कि कितना पैसा देना है.
Karthi, what is actually new, some new
Right,
format
sir.
we have done?
Right,
Just
right.
tell
This
them.
is the one. This is the one I'm telling them. Okay, sir. So these other publications are also there. For example, many which are not published by, I mean, which are not printed by Indian Nursing Council. You can look into the other publications. So we have not done anything new. We have done a facelift because we had all the information over there. So this is syllabus. You'll have a price. You'll have a postal charges. So you will know if it's 100 grams. If you want 2 books or 3 books, multiplied with 100 grams, and accordingly give the postal charges. Then we have circulars, resolutions. Wherever the INC resolutions are there, we will get it over here. And we have Gazette notifications, which all INC has published a Gazette notification with regard to syllabus, with regard to NRTS. All this will be available here. And there are annual reports. We have annual reports and audit reports. If you click on this, you'll get that. And we have press releases. Any press release INC wants for the advertisement, we can have it over here. Then Government of India guidelines. Anything on the ministry, anything on the midwifery guidelines, anything on the nursing schemes coming from the Ministry of Health, you can see over here. And we have an ad hoc inspector. So anybody who wants to apply for ad hoc inspector can download the application form and can apply to Indian Nursing Council. And it is also digital. We can also apply online. So now if you look into this is, see, where executive committee decisions are there. I'm sorry, it is word designs, it is decisions. So the executive decisions are there whenever Indian Nursing Easy Committee takes place. That is for any decision, especially on the institution, one can see by uploading the school codes. And first and the last one, institute login. I think here is a one where you have a lot of applications. This is very important for us. You have application for renewal suitability, application for renewal suitability. See, please make out the difference between the suitabilities. I will take this opportunity to tell you what the difference between all these 5. The institution which is recognized by State Nursing Council has not given any proposal to Indian Nursing Council. For them, the 5th one will be is necessary. The one which is recognized by Indian State Nursing Council and has not approached Indian Nursing Council, that means has not given any proposal to Indian Nursing Council, will have to apply online on the 5th one. And the one, for example, the State Nursing Council or the state government has given for 50 seats and Indian Nursing Council has only given 40 seats. For them, they have to come for the enhancement of seats application. That is the serial number 4. Coming to serial number 3, the one which is recognized by State Nursing Council and has Indian Nursing Council has found deficient. So those institutions will apply on the 3rd one, because I see many people getting confused that who are eligible for re-inspections will apply on the serial number 5 and then the serial number 4. Then we have to tell them we'll refund, apply on this URL. So these are called URLs, right? And the application for renewal suitability. Now there are 2 ones. So 2021 is closed. Now we are open for 21-22 and the last is 31st May 21. So please ensure that you all put it on the proper time. Don't go till December. Don't go on for asking for the extensions because we have given enough time. February onwards, it is there. It is there till 31st of May 2021. You want the names to be on the website, so you need to be hurry up. Right? So if you go on in the later part, it will take time. It will take much more time for us to process because the processing is involved in this. In all the applications, a process is there, right? And here in the applications one, remember that you have to remember your login ID and the password. This is very important because in the renewals, it will be there for the next 10 years. The same login and same password, right? But whereas for the re-inspection and for the enhancement of seats, for that, each application have a new user ID and new password. Like once the inspection is conducted, and if you again found deficient, you have to come with a new user ID and the new password. For it happens with the enhancement of, say, the application is linked with the inspections. As soon as the inspection is conducted and you are not satisfied, but you want to come back for the enhancement again, you can apply with a new user ID and new password. The same login will not apply. And so we have a, like the way you have, once you give a final submission, it will be to the Indian Nursing Council, right? So you cannot access those files. So we cannot give the compliance. Yes, after we process, we'll say the documents are deficient, then only you can apply as a compliance. So there's a compliance is also there. We have got 3 compliances, right? So we have given 3 opportunity to you after submission of the final submission of the main file, right? So these 3-4 opportunities are given. So please ensure that you give the compliance in the proper. We are not going to accept any hard copies from now onwards, right? Because we go for Digital India. So next is, I think I will not take much. This is about INC, and there is circular, there is NRTS. Anything about NRTS, please look into this. And the latest updated notification, please look into the blue one, the darker one, so we can roll up and down and make it. You can also zoom in and zoom out. And also there is, it's a Hindi is also there for somebody who can understand. And we have a PhD in nursing. So students who are there in the PhD nursing, look in the website here for any update on PhD. And equivalency, the proforma is there for any foreign degrees. You can always apply to. And e-learning, what Madam today launched, will be available on this e-learning. So any modules which you are going to update now. Next, after this, you are going to have on e-learning on the midwifery. So right, so to that you can look into this e-learning. So all the e-learnings will be placed in this e-learning block only. And International Nurses Day celebration, for example, the last one is 2019. It will available now. And as and when we have NFNA 2020, that is National Foreign Scientific Award 2020, we'll update it over here. And we have anything on the anti-ragging, you can look into this. Any questions, FAQs, whatever it is, any media that is press release, it will be here. FAQs are there, and statistics, that is how many institutions are there, how many nurses we get every year. So the statistics tells you all about. Coming into the events and seminars, anything you want to look at the events and seminars, it will be there on this, right? And any webinars, any new and list of nursing institutes is always here. For example, you can look into the list of nursing institutes here. And then, which is, I think, very interesting. I think this is a page more downloaded all the time, not anything else. So I request it to also see wherever we are going. See, we have the latest updates here. So you need to look at the latest updates here. And we're also coming with a special attention, which is the latest the new one will be seen here, but it will come down later on to this latest updates and notifications. So you can search here for any development in the latest updates and notifications. So we have a different category now. Here, before we had everything on coming up for you, the flashing on the website immediately on the front. No, you need to explore, and you need to especially look into this latest updates and notifications, which give you the whatever the updates, what are the notifications with regard to last date or commencement or any webinars, because we are going to have a webinar on NRTA, that is Nurse Registration Tracking System. So that will be there. So any announcements will be on special attention or in the latest updates. So I think I'm through with this. Any questions if you have, we can you can have a question answer to all the speakers. But before that, I will request President INC to give his final remarks of today's theme. Thank you, sir.
Greetings from Indian Nursing Council to all of you. First of all, I would like to wish you World Health Day, because this is one of the World Health Organization, the technical global organization, which is giving the guidance to all the countries in terms of the health, in all the protocols, the latest guidelines, and especially you might have seen how World Health Organization has played an important role in this COVID-19 pandemic, because the World Health Organization every year they have a World Health Assembly in the month of May. All the global 190 health ministers, 190 health secretaries, 190 director generals. So they meet in Geneva every year in the month of May, and they'll be discussing the trends the scenario of the health situation at the global level, and this World Health Assembly addresses and comes out in the form of the resolutions, and these resolutions are sent to the all the countries for the implementation. So the World Health Organization is playing a very important role each year, takes up an important issue and asks the all the countries to focus that attention of the policymakers and the fellow health workers to focus in that 1 year to achieve that to communicate, to message it to all the people, to educate the community in that issue. Last year, the World Health Day, the theme was supporting the nurses and the midwives. You can imagine, see how the even for World Health Day, generally they used to make a general theme. But for the last year, the World Health Organization, being a 2020, the International Year of the Nurse and Midwife, to commemorate the 200-year birth anniversary of the Florence Nightingale, they were able to, World Health Organization, with the support of the Lord Nigel Crisp, who was the all-party parliamentary group on health, is a member of parliament from UK. He initiated this whole process to how to celebrate 200-year birth anniversary of the Florence Nightingale. That's how he took this proposal to the ICS, International Council for Nurses, and to the WHO. And Dr. Tedros is a very passionate for the nursing sector. I think after he joining, he was able to fill up the post of the chief scientist in nursing in the headquarters of the WHO. That itself shows how he is giving the importance to the nursing sector at the global level. That post was lying vacant for a long time. So within 15 days, he was able to fill up that post. And he has picked up a very bright chief nursing officer. She was not only chief nursing officer she also working as a health secretary of that time. The Tedros was working as the health ministry, was attending the World Health Assembly. He was knowing one nurse has become the health secretary of that country. So that now she was able to pick up the Iris to be the chief scientist of nursing. A lot of activities have started after that. So now the World Health Organization is focusing more on the nursing sector, nursing now, nursing challenge, Nightingale challenge. All these campaign have started to showcase the achievements of the nursing professionals, how they are important in achieving the universal health coverage. What Dr. Girdhar Basu was telling, and India is a signatory to the achieving the universal health coverage. Our Prime Minister of India in the United Nations, the declaration is one of the signatories. So India is being as accepted to achieve the universal health coverage. You might have seen how after the signing the USC agenda, how the government of India is allocating more funds for the health, achieving the universal health coverage. New programs have been conceptualized by the government of India. Coming to the very important program which has been conceptualized by the government of India is 1,50,000 sub-centers. They are going to convert all these 1,50,000 sub-centers into the health and wellness centers. And in this health and wellness centers, they have identified to have the mid-level health provider. And majority of the states have accepted the mid-level health provider as a nurse. That itself shows how the nurses are being positioned in the preventive and promotive and curative services. And that's what Girdhar Babu was telling, that we need the doctors are not going to the rural area. And I think for a long time nurses were craving that where are the posts are there for the nurses in the rural area. I think we had at least the post of staff nurse at the PhD at the 30,000 population. Now it has gone down to the now a full-time BSc nurse can become a mid-level health provider. Position that it's an opportunity for the nursing sector. It is a challenge also for the nursing sector. How we can deliver at the level of the sub-center, and that's how the Indian Nursing Council has amended the syllabus and incorporated in the public health nursing the duties and roles and responsibilities of the mid-level health provider into the BSc nursing syllabus. So now a person who is coming out in the 2020 with the new syllabus of the BSc nursing with the 2020, and they will be able to, without going through the 6 months mid-level health provider training, they can be straight away as posted as a mid-level provider. So a lot of many of the states have started positioning them, and in this perspective of 2020, I think which is very closely linked to the today's theme, the WHO has come out with the status of the world nursing report. I request all you people read that WHO's the status of the world nursing report, and all the issues which the nursing sector which is facing globally, and also even the issues which the nursing sector facing at the global level, which are all applicable to the India. So the main theme of the status of the world nursing report is investment. Investment to the nursing education. That is the main theme of this report, is investment to the nursing education and creation of the position. This is one of the problems we nursing sector in India we are facing, is positions are not created. In the absence of not creating the positions, so even the qualified nurses which are available, they are not able to get into those positions. Especially in the public sector, we have yet to see the optimum nurse patient ratio, whatever is recommended by the staff inspection unit of the government of India. Many states have not yet implemented that SIU norms. So if they start implementing the SIU norms, definitely there are a lot of positions are going to be there. Therefore, the zone report, as very clearly the theme is there: investment in nursing education, investment for the creation of the post, and the another important theme is leadership. So these are the three themes which have been reflected in that the whole report. There are a lot of evidences have been captured globally, how nurses are able to provide the qualitative, comprehensive primary health care services in achieving the universal health coverage, how the many nurse-led interventions in different parts of the world has been captured by the many of the governments. So, in that perspective, at least in India, we were able to start the nurse practitioner critical care program, and now the government of India has also launched the nurse practitioner midwifery program. And so the specialization is going to be the new mantra in the healthcare delivery system. There is a big gap between the physician and the nurses. The physician has already reached to the level of the MCH, whereas we have to work as a team member in healthcare delivery system. So we cannot be only a general nurse. So we have to, the national health policy also focuses on the training of nurses in the various specialties. So in that perspective, there is about 14 specialties which has been developed. So therefore, this one report very clearly says create more positions. For example, nurse practitioner critical care. Yes, we have a syllabus. After acquiring in the government sector, they have to create the positions. In the government sector, they have to start the training program of the in the critical care. Similarly, in the nurse practitioner midwifery program, there is the government of India has committed under the NHM. They are going to train 84,000 nurse practitioner midwives. They have committed. This is where the zone report, now I can see the reality in India, where the zone report says investment in nursing education. I think the NHM has accepted in principle as a policy. They are going to provide funds for training the 84,000 nurse practitioner midwives, and also all these 84,000 nurse practitioner midwives are going to be positioned in the midwifery led units, which are going to come up at the community health center in the rural area, where they will be able to conduct the deliveries, and also working as a team member in the gynecologist. This is a big shift. The government of India, after seeing the evidence of the Lancet series, where if you have a internationally ICM competencies, if you trained a midwife, they will be able to prevent the 82% of the maternal deaths and also infant deaths. So that Lancet evidence the government of India NHM has taken. That's how now the government of India is investing so much money in the midwifery to strengthen and also to reduce the maternal and infant mortality rate in India. So that is a big recognition which the nursing professionals were able to, because they have realized, yes, we need the nurses and midwives in the rural area to achieve the universal health coverage target of achieving the maternal mortality rate and also the infant mortality rate. So therefore, this 2020 and this zone report Now their WHO is asking all the countries to implement through the regional offices of the WHO. They are going to ask all the countries what are the 10 recommendations which are reflected, how each countries are very able to implement those recommendations. Now the data is one of the very oftenly now WHO is talking to the countries that you should have a reliable data. Data. I think they are talking. They have used the word now. I think our all nursing professionals are. You are going to hear more of a national health workforce accounts. So in the national health workforce accounts, we'll have all the health force accounts they are going to ask every year, and it should have a reliable data. And we are the only Indian Nursing Council regulatory body who are able to have capture the 1 million nurses linked with the Aadhaar number. We were able to get the live registry, and within another 6 months, we'll be able to complete the whole process. So the one of the problems the nursing profession was facing the legal empowerment for the nurses. In the new National Nursing Midwifery Commission, which is they have included in that commission report that it will have a new National Nursing and Midwifery Commission will have a scope of nursing and midwifery practice, which is one of the problems. The potential of the nurses and midwives what they have trained, but they were not able to work effectively in the healthcare delivery system. So this the scope of nursing and midwifery practice will give a legal empowerment for the nursing and midwifery personnel in the tertiary and also in the rural area. So therefore this today's theme is more linked to the 2020 the theme of the WHO and also the International Year of the Nurse. And this zone report gives a lot of way forward for the nursing sector to work at the national level and also toward the state level to achieve the World Health Organization, this zone report has predicted for 6 million nurses, 6 million nurses, and also now they have come out with the aging population of the nurses. Now their data shows of the WHO says 13 million nurses globally shortfall by 2030. So therefore, there is a big scope and also not only training and also improving the quality of the nursing education. That's why Indian Nursing Council has developed one of the state-of-the-art National Referral Simulation Center, the competency-based training program we are going to introduce, and the new BSc nursing syllabus will have a simulation-based more of a training because international evidence shows that 50% of the BSc nursing syllabus can be implemented through simulation. So that through simulation we can improve the competency-based training program. So I wish all the participant nursing professional who have joined this webinar through this the World Health Day. There is a long way to achieve our some of the issues and the problems the nursing fraternity which is facing, which has been addressed in this State of the World Nursing Report. Now it is for the nursing professionals how far we can take forward through this State of the World Nursing Report, how this can be implemented at the national level and how it can be implemented at the state level. So therefore, the various unions and the nursing professional association have to work together to achieve these the stated goals in this report. And where already we are seeing some sort of a positiveness of the government of India investing the money for the nurse practitioner midwives. That's the way forward now for us to, and that motivation has to go down to at the state level. So various career prospects, working conditions, all those issues have been reflected, and it is for us how to take forward of these recommendations for the implementation. I wish you best of luck. If anybody would like to, if anybody has put some question in the chat box, I'll be willing to answer those.
Thank you so much, sir, for your detailed speech. And for me, it's really pleasure. I couldn't leave the webinar in between because I was so much enjoying the information. And to upgrade myself, it's really important. So thank you so much for your time.
Thank you very much, sir. And we are very, very grateful that we are having a visionary president with us as of now, because he is, as Madam said, that is very, very informative. Yes, it's informative. Not only informative. Yes. You ask any question anytime in midst of so many chaos, he will give you a right answer. I mean, that's what we have seen him, people thinking how he manages to, go from here and there immediate, that's the thing which we take some time to go from this mode to that mode. I mean, he talking about something else and suddenly if somebody asks you about the nursing, He is there to answer you immediately and the right answer. With all the statistics. That also remember that statistics. So he's an encyclopedia for us. So,
Wow.
thank you very much, sir. They want more on the nurse practitioner. People are not aware of the nurse practitioner.
See,
Courses.
I don't know how many people are. We struggled in the ministry. The word nurse practitioner is an allergy to the, with a due respect to the medical fraternity. Because when the medical fraternity goes to the abroad, they are very happy to work in USA and other developed countries as a nurse practitioner, one of the key member of the healthcare delivery system in overseas. They are very happy there. But when it comes here, somehow or the other, I have experienced with the policymakers how difficult to convince in the government of India to ultimately we started putting in the National Health Policy 2002, and the 2002 National Health Policy reflected we need nurse practitioner. I think we brought, we know that the medical fraternity will have an allergy to this word of the nurse practitioner. So we were able to push through the policy document, and ultimately with great difficulty through the US Australian agency development, the first thing Indian Nursing Council did was, under the leadership of the then Joint Secretary Sujata Rao, I can't forget her name, how she was she was helpful for the practitioner word. So she told that, Dilip Kumar, you can't as a nursing advisor, you can't do as a nurse practitioner. You have a lot of bottlenecks in the medical fraternity where you are in the ministry. Ask your the council to start the nurse practitioner midwifery program, and she was able to facilitate getting the Australian agency development. We started with the government of West Bengal and the nurse practitioner midwifery program, and we struggled very hard with the government of West Bengal to create the about 7 posts, a dedicated post of the nurse practitioner midwife. They created, that is the first state where the word in the recruitment rules, because many people in the public sector, you understand how difficult to have a RR recruitment rules, and for the recruitment rules, then it becomes a legal document. So the first state could create, then the Gujarat followed it up. So now the NHM has taken over. They have really realized, yes, we need nurse practitioner midwife. There was a lot of policy discussions went on, and there was a lot of discussion that we should have in like Europe. You have a separate category of the midwives, separate entry into the midwife program. All that dialogue which helped through the UNFPA and UNICEF and the WHO. Ultimately, the government of India and Indian Nursing Council for agreed for the nurse practitioner midwife program. It has been now launched. Prior to that, Indian Nursing Council was able to come out with the nurse practitioner critical care program. It is a 2-year residency program. Now the mindset of the training of the nurses has been changed in this nurse practitioner critical care program. Just like a MD, MS, how the medical fraternity, they do the MD and MS. Similarly, there will be 2 years. They will be in the clinical. Only about 15 to 20% theory. There's no need to go to the much of the classroom. They have to attend only seminars and symposiums. So they will be in the clinical level. So that nurse practitioner, at least government of India gave a stamp by approving, and also they in the minutes they said yes, they will request all the state governments to start this nurse practitioner critical care program. So now for that, legal empowerment is one of the issue, which that's why we work with the Ministry of Health in the proposed draft. You can see the scope of nursing and midwifery practice has been reflected, because as on today, Indian Nursing Council Act is not empowered to have the scope of nursing and midwifery practice. We were all implementing through the institutional protocol on the basis of the syllabus and regulations what our nursing graduates acquired, and the institutional protocols give the legal empowerment for their practice. But in the new Nursing and Midwifery Commission, it is there, so they knew they will be able to say that different specialty people will be able to what are the procedures they can empowered to practice, to what extent they can dispense the drugs, and also what extent some of the investigations they can order. All that is going to be empowered by this new commission, so that then one of the problem which our nursing and medical profession is facing about the legal empowerment, that has been taken care of in this. So therefore, I think we need more now. We are getting a lot of requests now. The nurse practitioner after the critical care program. Now many of the experts are asking in overseas. You have a DNP program, Doctor of Nursing Practice. So now we have worked with the University of Houston. We have an MOU with the University of Houston, and we are going to start shortly with the two institutions on a pilot basis, a DNP program. So besides working with the DNP, we have a nurse practitioner critical care program, nurse practitioner midwifery program. There is a lot of requests we are getting for the different specialty program. So there is a need for us to, I think, gradually in India we are going to see as many as nurse practitioners in different specialties. That's going to be the new because the all experts have realized the in various specialties nurse practitioners are required, so that they will be able to work effectively. Many of the physicians and even many of the icons of the healthcare industry, even including the planning commission, they mentioned that the ICUs can be best managed by the nurse practitioners. That type of a message has been given in the policy level. That's why you are now seeing a more positiveness for the, but still a long way, because I am telling you, because we are working as a team members in the healthcare. You even in the policy table when we sat to approve the nurse practitioner critical care program, where the health secretary was approving that, at that time we had our in the same table we had many of the medical fraternity was not willing to approve that program. To tell you honestly, because people who attended in that hall can remember how resistance was coming from some of the medical fraternity people. So there will be a there. So it is a now challenge for the nursing fraternity how best make use of these titles which are given, so that we'll be able to improve the quality of the healthcare delivery system either in the hospital or in the community.
I think President Sir has explained you about DNP. We need to have. If you want to look into the Indian Nursing Council YouTube, you can again see that the whole whatever webinar went through this. Okay, so I just want to tell you there is a nurse registration tracking system. Everybody is asking about it. So you need to register. You need to enroll. Once you are a nurse, you have to enroll. Not before that. There is a primary registration. There is a reciprocal registration in that. We will have a webinar within a month. The webinar will be noticed on the website. So please be looking onto it, right? Anything new on the way? We are going to connect series of webinars as we are going to have new BSc syllabus. We'll have a webinar on this, and we have webinar already on the NPM and other things which are available in Indian Nursing. You have to go to YouTube, search for Indian Nursing Council YouTube. So you'll get a series of webinars which has been, we've already hosted it. So it's there on the YouTube now. For your today, we were live on the YouTube, and the same will be there for your information. Anytime you can download and see. And coming to the e-learning, what Madam Dr. Asham has launched today, it is on our website, Indian Nursing Council website. As Madam said, Madam already, Dr. Savajit Kaur has said that we go live only after a week. We have launched it today, but go live after a week. Okay, so I showed you the e-learning on the website, right? There is a tablet on e-learning. So go there and you can register there. You can't download, you can just go on working on it. You have to have an internet connection for it. Can't download. YouTube you can download, but not the e-learning, right? You have to be on it through the internet, right? And any other questions and answers, you can always write to js.inc. So we will add gov.in. We will respond to it. If anything related to this theme and anything else related, any queries, you always respond to you. Any secretary.inc@gov.in or js.inc@gov.in. And before we leave this today platform, I would like to acknowledge Dr. Punita Zilarazu for the e-learning COVID. I mean, she was a backbone for this PowerPoints and everything. And I think you can also see the webinars which was conducted last year. It's also available on the Indian Nursing Council YouTube. So we do want to acknowledge Madam with her hard work and with the support of the other nursing educators who are already also involved in this e-learning project. Thank you all. Thank you very much. We do acknowledge all their efforts today. And it has, because of their efforts, it has seen the day today for the launching. So thank you very much from all of us to the speakers who have spared their time for this World Health Day program, and also the participants who were there with us till the last moment. Thank you very much. Thank you.
Thank
Thanks a lot.
you. Thank you so much.
Presence, sir, you're muted. Presence, you're muted.
We
Sir
request,
is looking very happy. Sir is always smiling, happy with a successful webinar.
we request you, with the visibility of the nursing profession in the eyes of the public, I should be there. I think you can do that, because we are very happy that you are doing already. You are doing already.
Yes,
Many
sir.
of the,
I'll do my best, sir.
we are seeing that, but at least COVID-19, we have also seen the visibility. Many of the common public have realized how important the
nurses are.
I think
Yes.
general public. So now,
Yes.
once the general public is aware, then they have to move forward for the at the legislature level, parliamentary level, asking more
Yes.
questions and more noise, and so that the investment of for nursing and education should come through the legislation only. So therefore, creating in the eyes of the public, ultimately they are the representatives of the public, where they can work for getting more funds at the legislatures in the assemblies and also at the parliament. So therefore, visibility in the eyes of the public is very important for nursing profession. I think you are doing that job, and we request you to continue that job.
Thank you, sir. Thank you so much.
So
And
thank you.
I'm always welcome for the ideas from you, that what better I can do. Maybe different ideas I can get from you. What more I can do my best. So please, sir, if any ideas you can share with me anytime.
We'll come back to you. Various the programs need to be launched, and because I feel, with all said and done, visibility, I think
Visibility is very important. Yes.
that is very important. Then only at the parliament and the legislative level, people will because
Acknowledge.
acknowledge it. Not only acknowledging it, investment should go up.
Investment.
Until
Yes,
unless
yes.
investment is not there, the sector will not grow.
Yes. Thank you, sir. Thank you. Thanks for your time, and thanks for this wonderful webinar.
Thank you for your. I know you are busy in your schedule, and still you are able to make it to participate in this webinar. Thank you very much.
Thank you all.
Sir.
Thank you very much.
Thank you,
And
sir.
good afternoon and namaskar. Thank you all.
Namaste,
Thank you
good
very
afternoon.
much. Namaskar.
Bye.
Thank you.